Okay, Assalamualaikum and hi to all participants in this forum. For surely, I introduce myself first. My name is Muhammad Amirul Muhammad Zul Shafi'i. Today, we will discuss one topic that is important in our daily life, which is mental health awareness. In this forum, we have five panel, which has a great background in mental health field. We'll discuss several topics in mental health. Okay, in first round, please welcome panel 1 to introduce yourself and answer in this question. What is definition about mental health awareness? Okay, Mrs. Asmani, please welcome.
Uh, Thank you, Mr. Amirul, for wishing me about that question. Firstly, my name is Asmani binti Abdullah. Okay, back into the question. In recent times, there has been a lot of focus on mental health. In line with the progress of our country, which is now developing, mental health problems and mental illness have become more and more, and there is an increase from year to year. It was found that the significant increase in the rate of suicide and mental illness over the past decade is due to poor mental health. Therefore, it is important for Malaysians to be aware of the importance of awareness of mental illness, the importance of the maintaining a good level of mental health and identifying the symptoms of mental health problems that require intervention and treatment. There is no official terms or one fixed definition of mental health. Cultural differences, subjective assessments, and professional theories have influenced how mental health is defined. Mental health is a state of well-being in which an individual is aware of his own abilities, can handle stress well, can work productively, and is able to contribute to society. This means that mental health is a basis of individual well-being and the ability of society to function effectively. Mental health is an expression of emotion and symbolized to ability to adapt in various pressures and demand of life. However, there is no clear line of demarcation between those have good mental health and those have do not. There are many levels in mental health. There is no single criterion that can be used to prove good mental health. No individual has all characteristic of good mental health at all time. It depends a lot on individual, social and environmental factors. There are several social, psychological and biological factors that determine the level of mental health of a person at any one time. Mental health can be affected due to socio-economic problem and sudden change in environmental and social conditions, stress at work and physical illness. Unlike mental health problems, those is mental illness also experience a condition where a person's mental state causes daily functioning. The individual is affected either socially or occupationally. It need treatment. That's all from me. Thank you.
Okay, thank you first panel for answering that question. So we know that mental health is very important to ourselves and give an impact to our community. So for second panel, I would like to know how the mental illness happen in life.
Thank you, Mr. Amirul, for giving me that question. Firstly, my name is Muhammad Faiz Benzarin. Why does it happen in life? There are various factors that contribute to health problems and result in a person experiencing mental illness, including several experiences such as trauma or a history of abuse such as child abuse and sexual assault. Experience related to an ongoing chronic medical illness such as stroke, cancer, or diabetes. Biological factors such as chemical imbalance in the brain, recreational use of alcohol or drugs, lack of exposure or social interaction, have feelings of loneliness or isolation, family history of mental health problems. Four types of common mental illness. Firstly, depression. Affected more than 264 million people worldwide in 2017. Although considered common and treatable, it can be serious because it can affect emotions and behavior. Secondly, anxiety occurs when the reaction in a situation goes beyond normal. It causes a sense of dread, fear or apprehension accompanied by physical symptoms such as trembling or nausea. Thirdly, bipolar disorder, a psychiatric disorder that can cause unusual changes in mood, energy, activity, and the ability to carry out daily tasks. Lastly, schizophrenia, a psychiatric disorder that can affect the thoughts, feelings, and behavior of the patient. Individuals at several levels may experience chronic symptoms that can affect life. That's all from me. Thank you.
Okay, thank you, Mr. Faiz, for giving us information about mental illness. So, for third panel, can share to us about misunderstanding, stigma, and discrimination on mental illness. So, Mrs. Miza, please welcome.
Thank you, Mr. Amiro, for asking me this question. Let me introduce myself first. My name is Nohamiza binti Azmi. So, misunderstanding, stigma, and discrimination, unfortunately, many people have a negative perception of mental illness and mental health problem. Labeling the individuals as crazy, unstable, dangerous, violent, and delusional can contribute to worsening. Correcting the wrong perception by understanding the correct facts, including therapy and support, is just a waste of time. Many recover because they undergo therapy with trained experts. They get support from people around the throughout the recovery process. Find out your level of mental health using the discretion, anxiety, and stress scala. Stress scala test. Thus is a guide to identify symptoms and early indicator of wherever you need mental health treatment or not. This test will be evaluated by a training evaluator such as a doctor or psychiatrist. Get the data from provide on the website of the Ministry of Health Malaysia, KMM. Acting reality and unpredictably is the nature of mental illness. This is not a mental illness and it is not the cause of mental health problems. Only 3% to 5% of individuals with serious mental problem at evaluate. Conversely, individuals with severe mental illness are 10 times more likely to be victims of violent crime than the average person. The act of labeling such individuals as crazy, unstable, dangerous, violent, and delusional can contribute to worse things. That's all. Thank you.
Okay, thank you, Mrs. Miza, for sharing to us about misunderstanding, stigma, and discrimination onto mental illness. From that, when some people get the mental illness, they must get treatment to covering the illness from begin a bad situation. So to our fourth panel, can you share what the type of treatment can we do to help people from this illness? So Mr. Kamarudin, please welcome.
Thank you, Mr. Moderator, for the question. I think not late to me to introduce myself. My name is Kamodem Hamzah. So, how to treat mental illness? Type of mental illness that need treatment: neurosis, psychosis, organic mental illness, such as dementia, personality disorder, psychiatry. Among children, as autism and hyperactive drug and alcohol addiction. Society attempt compare the treatment of mental illness. It usually include physiotherapy, social treatment. Physical treatment and physical treatment such as counseling, physiotherapy, behavior social as a treatment physical. Treatment in addition to medicine, the use of electric current may be necessary for some patients who are too depressed or too aggressive, who do not respond to the medicine. Psychology treatment, physiology for this patient including counseling and physiotherapy. This counseling include education that explain the symptom faced by patient, aspect of drug intake, the concept of stress, how to deal with its self-motivation and self-esteem, aspect of family relation, of work, college and other. Physiotherapy is two-way physiological treatment between doctor and patient that require the doctor to follow certain course and training. Among the form of a physiotherapy, perform dynamic physiotherapy, cognitive physiotherapy. However, not all patients are suitable for the type for physiotherapy treatment. Only for certain neurotic patient, and the patient must be high motivated, open-minded, intelligent, and the disasters face into chronic. Patient relation is in the past color, the perception and behavior of patient in the present. In undergoing the physiotherapy treatment, the doctor will explain the cause dynamic of a conflict occurring of starting. The conflict at a person face, whatever is a relationship with a parent or family, greatly shape the way the patient interact with other individual. Therefore, it's important for individual for who help treat a patient to explain the situation they are experiencing to help them deal with the problem. This type of treatment can be done individual in a group treatment where other patients are taking in a total 4 to 6 people with almost even age range in addition to similar in personality and similar problem. Throughout in this method, patients will exchange opinion with each other and try to learn to deal with the problem they face. That's all for my opinion.
Okay, thank you to Mr. Kamarudin for sharing to us the type of treatment in mental illness. So to last panel, can share to us what program that government and NGOs do in mental health awareness. Okay, Mr. Hanif, please welcome.
Okay, Assalamualaikum and hi. Firstly, I want to introduce myself. My name is Muhammad Hanif bin Muhammad Rodi. Thank you, Mr. Amirul, for giving me a chance to share what is program that government and NGO do to keep mental health awareness in our community. The COVID-19 pandemic has caused health threats, loss of loved one, loss of source of income, and control of movement. In addition, this pandemic has also increased emotional stress, anxiety, and depression among the community and has an impact of the mental well-being of every layer of society in the world, including Malaysia. Accordingly, the Ministry of Health Malaysia has launched the Let's Stop Minda Sihat Media campaign, which is implemented in line with the mental health publicity plan under the Health Malaysia National Agenda. The first phase of the campaign focused on working youth and adults. Purpose of Let's Stop Minda Sihat Media campaign: encourage people to get support and help to achieve mental well-being, encourage family members and friends to provide support and help to those in need to achieve mental well-being. In line with the campaign motive, the Ministry of Health Malaysia has also stepped up promotion related to mental and physical well-being through to the Take Fast message. Take Fast, which focus on 5 important messages, which are: number one, stay connected. Build a healthy social network. Take time to stay in touch with family, friends, co-workers, neighbors, and acquaintances. Second one, activate yourself. Increase your fitness always to be active doing your favorite physical activity according to your ability. Number three, gratitude. Appreciate the blessing of life, contentment and gratitude for the blessing of life. Number four, explore interest. Highlight talent, learn knowledge and explore skill you are interested. Number five, and the last, give happiness in share. Give my appreciation, time, energy, and help to other in hope that this campaign will achieve its goal and at the same time produce Malaysia who are mentally healthy in facing the challenge of daily life. That's all from me. I pass to Mr. Almiro to talk more about this topic. Thank you.
Okay, thank you, Mr. Hanif, for the extensive review. We already at the end of the discussion in this forum. As a conclusion, I can conclude that mental health awareness needs to be played by all parties, starting from the family, the community, and the authorities. Mental health is very important to ensure that every generation living in our country can live a better daily life, not only physically healthy, but also emotionally, spiritually, and intellectually healthy. We also need to avoid the negative stigma of mental illness and should help them by providing support and counseling so that the illness they suffer from can be treated and recovered. Thank you also to the 5 panel members for their willingness to answer and discuss every question that has asked. Hopefully, the discussion in this forum can be benefit those of you who listen to it. Remember, mental health is very important. That's all from me. I hope we meet again. And thank you. And Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you everyone.